Hello, hello. I am Dr. Eunice Menja, and I am excited to be here. Thank you for coming to listen in my channel. I am going to be taking you through counseling practice. I have about 13 years of experience in teaching developmental psychology and human sciences subjects in the university level. I also have extensive skills and experience working with substance abuse patients. I do hold a PhD in community resource management, and I am an LMFT candidate. That means I am licensed in the state of Oklahoma as a marriage and family therapist to work under supervision. I have worked in the Department of Human Services here in Oklahoma State as a family services specialist and child welfare specialist, especially in foster care. And I have held many other positions. So I am excited to say that I have quite a good background in developing and delivering training programs, especially in childhood trauma, for those who are providing support to children. And I also I have directly provided care or programs for abused children and neglected children in Kenya, and also in Oklahoma as an independent certified life coach. I have worked with individuals, families, and couples to achieve their personal and relationship goals. I am a three-time author published on Amazon. I look forward to bringing my expertise from this background and experience to our counseling practice so that we can be able to provide the best care for our clients. So, if you're a student, especially those people who are taking counseling practice one, my university students, it's very important that you also take notes because the information I cover here, it will probably be in the exam, most likely be in the exam. So you will be taking notes and not just the key or the highlights that you see on the slides, but everything else I say. So the way I have taught this course, I have provided students with practicals. One time we had a visit at a rehab center and also my clinic. I I still plan to provide this opportunity for my students where there's a huge written project that is supposed to count towards the final exam, and we will be going through the course overview. So we talk about just brief introduction to this course. So obviously, welcome to Counseling Practice One again. The first thing that we need to talk about is the foundational. This foundational course is designed to introduce you to the essential concepts and practices in the field of counseling. So this course is part of the broader curriculum in counseling and psychology for those who were going to be in the medical field or in the mental health field. I am going to try and equip you with the necessary skills and knowledge that you will need to become an effective counselor or effective counselors in your area of specialization. So over the semester, you will engage with a variety of theoretical frameworks, develop practical counseling skills, and hopefully that you understand the ethical considerations that underpin counseling practice or professional counseling practice. So, some of the key topics that we shall be going over, obviously, we will look at the counseling theories, or of course, explore the major counseling theories, including psychoanalytic theory by Freud, which emphasizes unconscious processes and childhood experiences. The Humanistic Theory by Carl Rogers, focusing on self-actualization and client um, and client-centered therapy, and obviously the famous CBT, or the cognitive behavioral therapy by Aaron Beck, which addresses the interplay of thoughts, feelings, and behaviors. We know that counseling plays a very vital role in both medical and mental health settings. It supports individuals in managing stress, coping with mental health disorders, and also making significant changes or life changes. The skills and knowledge you will acquire in this course will be directly applicable in your professional setting. If you work in a hospital, if you end up working in a clinic or a school, or if you have your private practice. So by understanding and applying these counseling theories that we are going to discuss in the next few lessons, and techniques, you will definitely be equipped to provide comprehensive care and support to your clients, our patients. So, contributing to their overall well being and mental health is very, very important. Um, for the people that are working, especially in the mental health or even in medical health, ethical competence is going to be required. That's one of the things that you're going to be learning. Navigating complex situations professionally and making sure that you safeguard your clients in your own practice. So let's also look at counseling practice terms or terminology. Some of them you will hear. These are some of the best practice. So the course is going to cover practical counseling techniques such as active listening. We'll talk about empathy and rapport building. You will also learn how to use the questioning techniques effectively, and also be able to provide reflective responses to your clients as you do counseling and apply the intervention strategies that we are going to learn about today. So it's very, very important that you learn this key best practice behavior of counselors. So, when you talk about counseling ethics, understanding and adhering to ethical guidelines is very crucial in the field of mental health and especially in counseling. We are going to be going over the ACA Code of Ethics and discuss the concepts that are such as confidentiality, informed consent, and how to maintain professional boundaries with your clients, the importance of this course context in the field of medical and mental health. So pay attention, because ACA is the code of ethics that is provided to guide counselors and mental health professionals on how to definitely be ethical. Also, so the counseling plays a vital role in both mental, as I said, mental and medical health settings. It supports the individuals or the clients that come to you to help them manage stress, coping with mental health disorders, and also you are going to help your client learn significant ways of changing a maladaptive behavior or a negative behavior. So these skills and knowledge that you're going to be learning about in this class will definitely apply in helping your clients realize maybe some of the issues that are causing stress in their lives, issues that are causing their stress in their workplace or even in their relationships, and helping them to make those changes. So you will learn your role as a counselor, regardless of what area you decide to specialize in. Having these skills are very, very important. So we also, as I said, we talk about the theories and also the professional competence that you are required to have, and also the theories that guide the field of counseling. So as I said, we will understanding the fundamental counseling theories is not just because it is they're provided for us. It is also because we want to make sure that we are using evidence-based practice, and of course uh, what has been tested and tried and found out to be helpful for counselors and clients. So it is important that we understand those theories and help, so that they can help us develop the skills that all the techniques that we are going to be using, the basic counseling skills. So, learning ethical guidelines and professional standards is also very, very important, as I said earlier before, because your clients expect you to be ethical. They expect you to make sure that the information that they are giving you is not being shared with other people. So, as I also said earlier, that it is very, very important to maintain confidentiality. Whenever your client comes in the office, you need to obtain something that we call informed consent before the treatment starts, in making sure that you understand the limits of your professional competence, so that you can refer out whenever you are not able to provide the support that your clients need. So for the ethical practice, I said it's very vital because you protect the welfare of your clients that way, and also maintaining the integrity of your counseling profession. Applying theoretical knowledge in practical settings, the ultimate goal is to make sure that you have the required skills that you need. So, part of this project that I'll be providing with you to you it's that it will help you engage in role playing exercises, case studies, and also supervise practice sessions, so that we can bridge the gap between the theory that you learn in class and also what is out there. Giving you some type of exposure, visiting a counseling clinic or a rehabilitation center. So these activities are designed to help you gain confidence. It's not to punish you. Practical application in any type of learning obviously is very important in helping you even retain the information that you need. Some of the other topics we are going to cover in this course will include cultural competence. So, cultural competence is another critical aspect as we strive to understand and respect the diverse cultural backgrounds and beliefs of our clients. This is going to involve being open to learning about different cultural practices, whether it is around your campuses or dormitories or your workplace, and being sensitive to how these cultural differences influence your clients or your roommates or your classmates' experience and view of the world. The personal beliefs we all come into this field with our own personal beliefs, are the individual values, assumptions, and biases that each one of us, as a counselor or clinical practitioner, hold. So they are supposed to shape, or they have shaped, our personal experiences, our cultural education, and our upbringing. Our upbringing have been shaped by the culture that we found in our families when we got into this world. So those have been socializing you. So the importance is these beliefs influence how we also perceive our clients, how we perceive our issues, and the counseling process itself is impacted by our beliefs, and how can we make sure that we are protecting our clients from our biases that we bring from our cultural background. So the positive influence is the personal beliefs can provide a strong ethical foundation and a sense of purpose in the counseling work. So potential bias beliefs can also lead to biases that affect the counselor's objectivity and the quality of care provided to clients. So we are going to obviously make sure that we stress on the concept of self-awareness and reflection. So continuous self-reflection and having supervision when you are practicing, as I said from the beginning here, is that even though I have been licensed in the state of Oklahoma as a marriage and family therapist, I have to work under supervision, because that does not only make sure that I don't have my client, but it is also another way of reflecting on my cultural biases and making sure that somebody is reminding me when I am being biased. And sometimes the biases that we have can make us not see the perspective of our client. So supervision is very, very important. It's very crucial in this field. And also sometimes it's also a way of taking care of yourself after a hard day or hard week of working with very emotional clients. So it's very important for counselors to recognize and manage their personal beliefs. So we have techniques that we usually talk about, and we're going to talk about, such as journaling, peer discussions, and training workshops that people are required to have. We call them CUs. Can help us develop self-awareness as well as our cultural competence. Okay. So I don't want us to really talk a lot about other. Today it was just really going over the topics that we'll be discussing. But before I end, I would like to pose this question: do you know what is counseling? We are talking about counseling practice, but do you know what that means? Do you know the difference between counseling and related fields such as psychotherapy? Because we have been interchanging them. Maybe you have heard somebody call themselves psychotherapists, other people call themselves coaches. We also have people that usually refer to themselves as mentors. And what is your role if you become a counselor? What is your role if you become a therapist? What is your role? We usually do similar um, jobs in a way, but we also have very different roles. So let's talk a little bit about those differences. So let's first of all define the word counseling. Counseling is defined as a profession or relationship that empowers diverse individuals. Diverse individuals can be families, also it can be groups, to accomplish their mental health, wellness, and sometimes education, as well as career goals. So, counseling is really a process in which a trained professional, like here in the US, you need to have your training. Before you become a counselor, you would have to have your master's degree, and the master's degree, obviously, in the correct having the correct academic background that is considered for you. So for you to call yourself a therapist or counselor, you have to have a master's degree, and you also have to do this. We do a national examination that you have to pass, and then you can get your state licensure. And just being licensed in one state doesn't mean that you can provide your services to other states without licensure. So you'd have to also apply for license, and if each state does have its own requirements for you to become licensed. So it's a long process, but it is very, very important. So some people are called, some practitioners will be called licensed professional, counselors, licensed marriage and family therapist. The counselor uses specific skills and techniques um, to help clients address and resolve personal, social, psychological challenges. Also, counseling focuses on helping people make changes in their lives, as I said there earlier before, be able to achieve their goals and obviously make sure that they are improving their mental health and their well-being. So, for example, if I go to see a counselor, the counselor might want to explore the underlying causes of my stress. If I say that I feel stressed, if I say that I feel depressed, so what the counselor would want to do is try to find out what are the underlying causes that are causing stress in my life, so that the counselor can help me understand how work and maybe even my personal life could be interconnected, and also help me develop strategies so that I can have better coping mechanisms and reduce my stress. So, basically, in a nutshell, that's what a counselor would do. And of course, there are other areas where somebody has more training as a therapist or even as a psychologist, that you would have to work with the client in more depth to improve their mental health and even disorders. So we'll talk about that in the future. Okay. So it is important to differentiate counseling from other related fields such as psychotherapy, coaching, and mentoring. While that also might look like they overlap, each has its own distinct features and purposes. So psychotherapy often is used as I said, is used interchangeably with counseling, um, but it is going to refer to more depth work with mental health disorders. Psychotherapists who can also be psychologists, psychiatrists, or other licensed professionals often deal with more severe psychological issues, and they use or they utilize therapeutic modalities. Again, another example, if I decided to go to seek a psychotherapist, the therapist might and maybe might want to explore deeper into my stress. Will ask me about trauma, and I also said in the beginning that I also like to train on trauma informed care, because I care about the traumatic events and how those have impact our life today. So that would be the psychotherapist asking you a little bit more about your trauma history, want to explore more of the unresolved issues or traumatic events that one might have experienced that could be contributing to your mental health and sometimes even your physical health, your current stress, and also using techniques, and that would be techniques like cognitive behavioral therapy to be able to address if you have mental disorders. And that's when you're going to be using the DSM-5 and to try and figure out or make an assessment to see whether there is a diagnosis that is related to your stress, or sometimes just other mental disorders. So for the coaching, coaching on the other hand is more future focused and oriented. So I started out as a life coach. I'm a certified life coach, and most of the times when I am addressing, I'm working with a client is because they are looking into their future. Um, Coaches like me help clients achieve specific objectives such as advancement or personal development. Unlike counselors, coaches do not necessarily or address mental health issues. Again, you cannot just be a life coach and address mental health issues. That would be very, very unethical because you have to be trained in mental health to be able to work with somebody who is undergoing stress or even undergoing other mental health issues, um, mental issues. If I, for example, if somebody hired me as a coach, my focus was to focus on helping them set specific professional goals. I would help somebody develop a plan to achieve those goals, and I would provide support, make sure that I am also being the accountability partner that makes sure that I walk alongside them, and making sure that I am helping them become more accountable for their time and helping them achieve the goal. So I'll be like their cheerleader. I'm also mentoring them, and I'm also being their coach as well. So as a life coach, I am not allowed to deal with emotional or psychological issues, and that's when you are supposed to ethically you're supposed to refer that person to mental health expert. So that's the difference between counseling and coaching. For the mentoring, for mentorship, the difference between counseling and mentorship. Uh, so mentoring involves a more experienced person guiding someone less experienced in their professional or personal development, while um, mentors may offer advice and support. They do not typically have the formal training or therapeutic intent of counselors. So, understanding these distinctions will help us maybe clarify what we have heard out there. People use these words or titles in exchangeably, or they are not related to. They could be related, but they are not similar. So just be careful whenever you give yourself a title. I know for sure in America you cannot call yourself a counselor if you have not been licensed. You cannot call yourself a therapist if you have not been licensed. So, in summary, counseling is very, very vital, and it's very vital. It's a helping profession, and it is something that you need to be, you have to make sure that you remember that you don't have to be called a counselor, you don't have to hold a degree in counseling. But sometimes in your job, when you're an occupational therapist, you'll be using a lot of counseling skills, even whenever you become a doctor or even a nurse. Because when you're seated there with your client and you're telling them about how to take care of their health, it's part of counseling. But how do we become the best counselors in the world that are ethical and are protecting our clients from not harming them? As I said, for a mentor, you don't need formal training, but sometimes people will go for workshops and finish one workshop or two workshops and call themselves mentors. For example, a student get a mentor. Mentor might share experiences that they have learned. Maybe they have, you have somebody who has who is ahead of you in terms of career, and you want to reach where they are. So that's what your mentor will do. They will provide the career advice, help you navigate the professional landscape based on their personal journey. So not necessarily evidence based, but what they have done to be able to achieve what they have. So sometimes you'll hear this word mentorship being referred to, especially in the substance abuse rehabilitation, where we want, when the clients leave the rehabilitation center, we want them to go into the hands of a mentor who can help them become accountable and also help them stay sober. Um, so I hope if you have any questions, please, you can put them in the chat. This was really an introductory class. So for obviously you need to watch out for the next video so that we can start talking about some of these topics that I have highlighted in depth, and also help you prepare for your exam or even becoming the best counselor ever. So some of that information is from the references provided. I want to say thank you. Thank you very much for watching. If you found this video helpful, please leave a comment below. Share it with your friends. And don't forget to subscribe to my channel so that you can get more content and also we can reach more people. Obviously, your feedback and your support mean a lot to me, and will help me create better videos for you. If you're a student, please don't forget I am here for you to support you become the best counselor. And so if you have questions, please do not hesitate to email me or even put them in the chat. Thank you very much.